Welcome to all the participants joining in the today's sessions on Majja Dhatu. Actually, deep in Dhatu is a very unique topic, and many people have very seldom knowledge about it. Very often, people will speak about dosha and its ups and downs, but there are very rare occasions people speaks about the detail about Dhatu, and that was our attempt. That there is a series of Dhatu series where we try to analyze each Dhatu and try to know the pathology. So, as a part of your learning, I just want to speak today a little bit about Majja Dhatu because this will give an idea. You will get an idea how I am going to speak in my Dhatu's lessons. Whatever the structure our body built upon, fundamentally we try to understand that based on five elements, Mahabhuta. So if you look at Majja Dhatu, and it is dominated with Jala, Vayu, and Prithvi. And very often we think that okay, that is filled inside the Asti Dhatu is Majja. But it is not only the bone marrow, there are many things inside the skeleton. Those are like nervous system, those are like brain. Those things also can be considered under Majja Dhatu. And how do we know this? Because while explaining about the optimum quality of that dhatu, they explains that the person will be how highly intellectual, the person may be highly creative, having good capacity to do many things like that. And on the contrary, while explaining when the Majja Dhatu is depleted, and it is mentioned that there is a loss of memory, loss of difficulty in walking, etc. These were also considered as a cerebral atrophy. And we can see this problem like in cerebral atrophy, Alzheimer's disease. Many diseases are comes under this damages of the Majja Dhatu. And there are also in the classical book they mentioned there are so many things very good for Majja Dhatu, like milk, ghee, etc. There are plants also told, like Gontukola. Gontukola is like the Brahmi, the plant like Brahmi, and also mentioned almonds, gold. These are all very good for Majja Dhatu. By looking at this description itself, we can assume that most of the nervous system, most of the spinal cord, and the brain comes under the domain of Majja Dhatu. And while explaining how we should handle Majja Dhatu, how to combat with the disturbance of Majja Dhatu, they says that we have to consume regularly ghee, milk, almond, walnuts, and avoid mental stress, etc. And it also explains that avoid using alcohol, tobacco, and also to use Brahmi, ghee, Saraswadarishta. So these are all suggesting that when we understand Majja, it's not bone marrow, rather it is beyond that. Normally, when we consider about Majja Dhatu, often considering the bone marrow, the hemopoietic stem cells, how the blood is formed, etc. But we have to consider beyond the bone marrow, and we have to consider more deeper into that, considering nervous system, spinal cord, even the brain. While describing Majja Dhatu, they told that Majja Dhatu resides inside the Asti Dhatu. So inside the cranial cavity, we have the cerebrum, cerebellum, the different parts of the brain. And look at the inside the vertebral canal, you have the spinal cord. So like that, when we try to understand, we have to consider the whole brain, spinal cord, and because that is considered as more Majja Dhatu. Let us consider Majja Dhatu as a brain and spinal cord. So think about the different diseases of Majja Dhatu. So you have different diseases like dementia, Alzheimer's disease, many diseases we may consider treating in the perspective of Majja Dhatu. So, not only the brain, the spinal cord, the whole nervous system, let us consider these as the things that changes our system. And while explaining the dhatu, they also described different, which was very important to know how this spinal cord is covered with the different membranes.
Sorry, there was some spike there. You said some features, or what do we analyze?
Yeah, the spinal cord is covered by different layers of covering, and that also be described in the classical textbook under Majja. There is also a beautiful description in the classical book about the membranes of the Majja Dhatu and also Pitta Dhara Kala, that is called Pitta associated Kala. Kala is a membrane. So, whenever we have too much of Majja Dhatu, then we have problem. Whenever we have less Majja Dhatu, then also we have problem. And if if you want to know, if we want try to know more details about Majja Dhatu, we realize it is very snigdha, that is very unctuous, and very pichila, also soft, murdu. And every dhatu also have some waste products. So here you can see many of the secretions in the eyes, in the ear. These are also considered as a waste product of Majja Dhatu. And interestingly, there is also description to state that the hairs are considered as Upadhatu of Majja. And if we try to understand the functions of Majja Dhatu, means that fills the spaces, fill the cavities, and it has the capacity to transfer information through filling the spaces. Majja Dhatu also strengthen our musculoskeletal system, muscles and bone, because through Majja it can support our body. That is why Majja also enhances the endurance power of all joints. And if we look about, try to see the dosha domination in Majja Dhatu, Kapha dosha is majorly dominated there. And when we try to understand what are the pathologies it comes to the Majja Dhatu, it is related with bone marrow, it is related with the nervous system, spinal cord, and even brain. So in the classical book, they describe that if Majja Dhatu is disturbed, especially when it increased, you have heaviness of the eyes, heaviness of the body, etc. Nowadays, in clinically, we can see neurofibromas, many nervous system ganglions. These are all the problem of Majja Dhatu. And if Majja Dhatu decreases, then there is a big problem. Like there is an increase of space or akasha, and it can also produce different problems of reduction of bone, loss of bone mass. And if Majja Dhatu get disturbed, person will get vertigo, giddiness, even they become unconscious. Sometime person may get fainted, or sometime the person feel blackout. These are all typical sign of Majja Dhatu problem. And if you try to see how this Majja Dhatu is related with Vata, and it is very clear that Vata controls all the movements of this bone, tendons, and muscles. Hence, it also influences Majja Dhatu. Here, what is to be remember is that the Vata dosha controls both sensory as well as motor functions. So, when we take some examples, for example, in the Majja Dhatu, if Vata increases, especially the Ruksha Guna increases, you can see the cerebral atrophy. Suppose in the Majja Dhatu, if the Lakhu of Vata increases, then you may see Alzheimer's. Suppose the cold, the Shita of Vata increases in the Majja, then maybe an aplastic anemia. And suppose if Kharaguna, the rough Kharaguna increases in the Majja, then maybe a myeloid dysplastic disorders. And in the Majja, suppose the Shukra Dhatu, Sukshma Dhatu increases, then the person may have hypermania, or person will have different fantasies. And the chalaguna increases in the Majja. You can see the tremor, typical tremor in the Parkinsonisms, or torticollis like problems. And similar way, if the same thing, the pitta, if the Majja Dhatu influenced by pitta, excessive pitta, then we may have multiple myeloma. And if Majja Dhatu influenced by the Tikshna and Ushna guna of pitta, then demyelinating neuropathy. Similar way, if Laku of pitta increases, then hemolytic anemia. And if it is the Visra guna increases, it can create septicemia. Or in case of Saraguna increases in the Majja, it may be diarrhea due to cancer. Similar way, we try to understand Majja with Kapha, we get some of the pathology. These are all the pathology we see in everyday clinics. Like Majja with Shita, we see axonian neuropathies. Even the Majja Dhatu with Sthira Guna creates disease like glioma. So when we try to understand these type of informations, we'll get a lot of idea how things are happening. But if we want to know a little more about Majja Dhatu, we also should know how this Dhatu is having relation with Ama, Agni, Shrotas, Dosha, etc. Suppose if we have dosha turbulence, especially kapha vata and turbulences, Majja Dhatu have high possibility to influence. And if there is a mala, sneha or orifices, that's also there. So suppose somebody comes in your clinic and saying that I have wax too much, I have my nose secretions too much, like that, we have to consider something related with Majja. And when we considering the Agni, there is a Agni called Majja Dhatu Agni, but here there is no direct Agni influence in general. And now look at the sense organs. Majja Dhatu is directly related with the skin, nervous system. So whenever the Majja Dhatu problems, you can see paresthesias, numbness, many unusual sensations because of the nervous system. Another important thing about Majja Dhatu is it has a close connection with the Manas. That means if any psychiatric problem happens, it can influence our Majja Dhatu. And the reverse wise also, suppose if you have any Majja Dhatu problem, there is also chances to have a Manas problem. That is why we have to be very careful when Majja Dhatu get disturbed. Not only in the mind, it also influences the intellect. That is why many of the Majja Dhatu diseases like Alzheimer's, dementias, where you can see there is a change in the memory. And this Majja Dhatu also changes our intellectual perception if they have to get disturbed. You can see diseases like Parkinson's, Alzheimer's, vertigo, even stroke, brain stroke. You will see all this mind and intellectual disturbances. So, if we try to understand Majja Dhatu related diseases, it distributed from simple diseases to most complex diseases. For example, many musculoskeletal diseases also have a close connection with Majja Dhatu. Many Asti Majja relation diseases like joint pains and other things, we will find many times the influence of Majja Dhatu. Even many malignancies, there is a great role of Majja Dhatu because from Majja Dhatu, the blood vessels, blood creates. For example, in endocrine disorders, there is a condition called Cushing syndrome, where you have typical problems of the Majja Dhatu. Poor intellect, poor management of from the childhood itself. In neurological conditions like Alzheimer's, Parkinson's disease, cerebrovascular accidents, the blood bleeding happens and creating stroke. These are also related with Majja Dhatu. Another interesting thing in the Majja Dhatu is that look at the skin, especially look at the nail. Nail is a great indicator of problems in Asti and Majja Dhatu. Especially somebody comes in the clinic, they say, I'm getting blackout. That's a short span of period. They say it may be due to the epileptical seizures, or they may say some other things. But from Ayurvedic point of view, it is related with Majja Dhatu. And in the musculoskeletal system, especially those who have repeated fractures, age-related bone marrow depletions, anemia, these are all another interesting area where Asti and Majja is involved. And when we try to understand, many times we have to differentiate from Asti and Majja, because Asti is a Vayu dominant and Majja is Jala and Prithvi dominant. And as the age process, this dhatu also get first nourished, then maintained and declined. As age passes, they also decline. So, as we cannot expect the same quality of dhatu in the young age, middle age, or the old age. So now the question is how to strengthen our the Majja Dhatu. Ayurveda explains follow dinacharya. So go for oil massage, if possible, every day or every once in 2 days or 3 days. Self oil massage, and do nasya, small quantity of cow's ghee you apply inside the nose. This is very good for the brain. I often tell my patient, especially those who have tendency to have memory problems, asthimajja problem, I tell them take a small quantity of ghee, take with this your small finger, put that ghee inside your nose, take a deep breath. And I found it very good for doing this type of nasya. Regular bath, taking bath regularly, having a good quality food and proper sleep is also very good for Asti Majja Dhatu. And for example, if you want to specifically address on Majja Dhatu, especially to brain, vacha with a ghee or brahmi juice, and even meditation, these are very brain tonics. And of course, very important to have Abhyanga and Nasya whenever there is a time get, because this will helpful to improve our memory, intellectual competency, to improve concentration, reduces mental strain also. And a proper Majja Dhatu help us to have good knowledge, good culture, good education, even drama, architecture, like very soft skill also. So what makes then the Majja Dhatu get disturbed? It can be disturbed by food. It can be disturbed by its own turbulence, or it can be disturbed from the previous Dhatu, or maybe an external cause.
Sorry, could you please explain the second point? What do you mean by own turbulence? How does it work?
Its own turbulence means the agni of that dhatu is get disturbed. So this not get nourished properly. I'll give you some examples also. Um, for example, Majja Dhatu is not proper, then we may have anemia. So because the Dhatu Agni is not correct. And to correct that, Ayurveda says that, okay, try to use Majja of different animals, especially those who complaining of reduced memory, dementia, Alzheimer's. Ayurveda says try to do some different type of sneha, pasa, majja, like animal fat, bone marrow of different animals as a medicine. Sometimes the problem may be due to the previous dhatu. For example, asti got disturbances, it influences that into the majja dhatu. So we have to correct asti dhatu first, then only correct the majja dhatu. For example, somebody is having chronic anemia. So, okay, blood is originated from the Majja Dhatu bone marrow. But we have to start treating from Rasa Rakta Dhatu because from there itself it is a problem. Sometimes the patient has scoliosis. So, it is related to the muscle, bones, so musculoskeletal and involving to the Majja later. And another common problem of Majja Dhatu is due to the external causes, like a trauma. It may be an external trauma, or it may be an injury, or it may be a degenerative changes happening inside. Here you try to use different type of bandaging, sometimes immobilizes these things. These are very common thing. And there is also another important factor, which is the stress and anxiety of the brain that also produces long-running problem. Nowadays, these diseases are highly vulnerable, like stress, anxiety. It can produce not only stroke, heart attack, like acute problems. They can also produce chronic problems like Alzheimer's, dementia, like issues. So, what type of food we should give to them? We should can give milk, ghee, sesame oil, olive oil, castor oil. These are all very good because these are all nurturing the Majja Dhatu. A proper exercise, enough rest, proper sleep, even meditation are very good for stabilizing the Majja Dhatu. Sometimes over exercise, too much of exertion can disturb the Majja Dhatu, so avoid that. A good Abhyanga can strengthen Majja Dhatu very well. A good Nasya can nurture the Majja Dhatu very well. A proper food at proper time and adequate and proper sleep, these are all helpful for Majja Dhatu Agni to perform well. Hence, Majja can be kept well. Proper rest and habit of doing meditation, which also help for keeping the Majja Dhatu good. And even though our Majja Dhatu is depleting, so create some mental activities, brain teasers, good thinking, good atmosphere, and avoid mental stress. That will be very much useful in Majja Dhatu problems. If Asti Dhatu keeps us moving comfortably, properly, Majja Dhatu is the situation which keep our body more stable, more sthira. Or in other words, Asti Dhatu is for mobility and Majja Dhatu is for stability. So many times Asti Dhatu affects, you can see they have difficulty in the movement because of the mobility issues. But when it comes to Majja, person become totally unstable. There are many medicinal plants told in Ayurveda, good for brain. Most of them are also good for Majja Dhatu. Plants like Brahmi, Mandugaparni, Vacha, Shangapushpi, these are all some examples where Majja is nurtured. And also regular consumption of small quantity of ghee is said to be the best home remedy we can do for Majja. Many times when we ask the people to take ghee, they will fear, oh doctor, it may increase my cholesterol. We say, no, I used to take at least 5 to 10 grams of ghee every day. Have a habit of self-massage at least once in a week. If you have some memory concentration problem, make use of ghee as nasya. Because of these reasons, Ayurveda says so many medicated ghees told in the classical books like Brahmi Krida, Saraswata Krida. These are all very famous ghee people use for improving Majja Dhatu. Use of gold, Swarna. Use of Shirabala Avarti multiple times. These are also good for Majja Dhatu. Different type of oils, especially Brahmi oil, Rasataila. These are all some examples of oil which can strengthen directly Majja Dhatu. We also use bone marrow of different animals in Ayurveda for treating the Majja Dhatu problem. Different kriyakramas, therapies like Pichu or Lepa paste, these are all very commonly beneficial for Majja Dhatu. And continuous pouring of medicated oil on head called Tailathara is very good. It can also be done in the whole body called Kaya Sekam. Very important therapy in Ayurveda called Shirovasti, where a big cap is kept on the head and a certain prescribed amount of oil is kept. This is one of the excellent treatment when Alzheimer's, dementia in early stages of it. Different type of potali sweda that you are using swedana different type with egg will be very much beneficial. Or egg cooked in Shadafad churna, or egg cooked in ghee and rock salt. These are also good. If condition allows, then we can go for snehapana with a ghee or vasa majja and go for panchakarma. From panchakarma perspective, vasti, especially vasti with milk, virechana with aranda, castor oil, these are all very good. So again, as I mentioned before in the slides, different dhatu. In one dhatu itself, we can consider different guna of the dosha and identify the pathology and treat according to that guna. This is I already mentioned. Different gunas, and according to that guna, we may also choose appropriate medicine on that given situation. Okay, so now it's already 2:50. Now we'll open for the questions. So there are so many questions. So we'll see one by one. So the first question is darkening, clouding as a sign of imbalance of Majja Dhatu includes orthostatic darkening of the eyes. Yes, orthostatic darkening is also eyes is also have influence of Majja Dhatu in Ayurveda. Another question is how can I improve the condition of 59-year-old woman with a chronic tremors that has lasted more than 10 years? She says it is hereditary. Okay. If it is not a Parkinson's disease or if it is not related with any neurological thing, try to give small ghee nasya, every day small amount of cow's ghee nasya, that will be very much beneficial. Okay, the next question, what if children have a large accumulation of the wax or plaques? Is the normal or an abnormality? If it is too much of accumulation, it is abnormal only. That means that Dhatu Agni, Majja Dhatu Agni is not functioning properly. So you have to give some medicines to improve the Dhatu Agni in the children. Then that condition will become better. Is partial atrophy of the optic nerve due to trauma also problem in Majja Dhatu? Yes, it is from Majja Dhatu. Normally, we try to do a therapy called Shirovasti. A cap is kept over the head and some prescribed specific oil is kept. Shirovasti can help in improving the optic nerve problem. And the question is how much milk and other things as I should consume when I that question is very it depends upon the climate, it depends upon the place you live.
So it's about the combination of milk and ghee, you said.
Okay. Oh, it's a combination of milk and ghee. Okay. Normally, I use some 20 ml of milk and half a teaspoon of ghee.
Walnuts and almonds, what is the weekly and daily amount?
Yeah, I often recommend people to take between 3 to 5 pieces, not too much.
You mean whole nuts or what?
Yeah, whole nut. Yeah.
Okay.
Since the function of the Majja Dhatu is hematopoiesis, then can cycle disorder also be corrected? Yes, it can if you correct the Majja Dhatu properly, we can avoid the changes properly, especially even the menstrual cycle disturbances. Lipoma are also the sign of Majja Dhatu imbalance. If there is a treatment for whole spread condition, if lipoma is there in the whole body, that is it's a very rare condition, but it is very difficult to treat. If it is in the local area, normally surgically it will be removed.
Okay, could you please add, is there a connection between this condition and Majja Dhatu?
Yes, there is. They are linked. We have to correct the Dhatu of Majja. Anutailam is not that. Next question is Nasya drops Anutailam version than Anutailam is a good choice, not a good choice for Majja Dhatu issues. As I mentioned, cow's ghee. Cow's ghee is the best choice for Majja Dhatu. Anutailam is not a good choice at all. Is it good to lubricate your eyes with oil? The same way suggested to your nose by rubbing your little fingers with oil and lubricate your ears. No, eyes oil is not good. Whenever you have eyes, you can use ghee. Nose oil is okay. Ghee is better at this situation, but you can use oil, definitely oil for these.
Okay, sorry, I got confused during your answer. Could you please repeat it?
uh, Oil should not be used for the eyes. You should use only ghee. For nose, you can use both eyes and ghee. For the ear, you should use only oil. So in the ear, don't use ghee. Ghee is good for eyes. Ghee is good for eyes. Oil is not good for eyes. Oil is good for ear. Next question, does Majja Dhatu also influences the vascular system and Dhatu associated with one of the chakras? Not really. Actually, don't take chakras into the plane because they are all in the different medium. Chakras, dosha Dhatu malas are in a different domain. Chakras are in a different domain. Don't mix it with each other.
But the first part of the question, is there a connection between Majja Dhatu and vascular system?
Yes, it is. There is a connection with the vascular system. Yes. Does it make sense to treat anemia with iron supplements, or it is more important to improve the absorption and functioning Agni? The second part is important. First, you improve the absorption function of the Agni, and maybe already iron is available in the food, but your body is not able to consume it, transfer it. So, if degenerative process of bones and association with Majja Dhatu, then gout, arthrosis associated with mother, yes, no doubt, it also influenced by Majja Dhatu. Next question, do you know any case of Alzheimer's disease cure? No, not totally. We can improve better than before. We can improve the quality of life. Is it possible to just put ghee in your nose, or it better to apply it with your little fingers? It is better you apply with the little fingers. Is it playing checkers good for training Majja Dhatu? Yes. Many people eat clay for anemia. Whatever. Okay, clay. That is a different situation. They have that's called pica. Unedible things are eaten by this. That is not related with Majja Dhatu. It's a problem of Resarakta Dhatu.
Sorry, could you please repeat what dhatus are the problem?
Resurrect the dhatu. If the person is taking clay, other things because of the rasa and rakta.
Okay, could you please repeat? Do you mean that clay affects rasa and rakta dhatu, or what was the answer again?
Because there's a shortage of many nutrients in the resurrected dhatu. That's why a person feels to eat these type of things. Are glaucoma cataracts are Majja Dhatu? No, glaucoma cataract are not directly to the Majja Dhatu. There are other issues are related with Majja Dhatu. Glaucoma cataract are not directly in that. Can we measure to improve with the help of disorder? Yes, cataract and glaucoma can be treated with Ayurveda very well.
So I'm not sure that the translation was correct. So is it possible to is it helpful in a condition like glaucoma and cataract to correct Majja Dhatu? Does it have any effect?
Yeah, no. Glaucoma and the cataract, it's not directly linked to Majja Dhatu. And is it possible to be lubricate the ear canal with a ghee? No, as I mentioned, don't use ghee or sesame oil. Use sesame oil is better. Nose, you can use both. Then, should Abhyanga be done without including the hair of the head? Yes, it is possible. You can do only in the body except the head. It is possible. And what oil we can use, like Dhanvantara Thailam? And thank you for useful website insight. Could you please tell me how to improve Majja Dhatu Agni? Yes, all the details you will see in the seminar. I invite all of you to join for this online course. We speak each dhatu. You see, just 1.5 hours, we have so many things. So imagine there is a session where Rasa Dhatu, Rakta Dhatu, Mamsa, Meda, Asti, Majja, Shukra. So definitely it will be very much useful for you. So join for that program.
Okay, we have some more unanswered question at the end, at the bottom.
How to clean sneha waste from the eyes, ears. Ears, you put oil and just keep it few drops of oil in your ear, then you just clean it. That will be very much useful.
Okay, so there was also second part to this question. Is oleation and the use of ghee, is it only nurturing effect or a cleansing effect too?
It also have cleansing effect. Yes, I request all of you again join for a wonderful Thadu level, and we can have question answer sessions, and I will answer you few more questions. And we are also planning our on-site program in March. Those who wish to join for Kaya Chikitsa and Panchakarma combined course on first week of March 2026. I invite all of you, those who wish to join India, on-site program in India, where we have extensive lessons, case studies, clinical practice, bedside work, many things. Those who are interested, please join. So, namaste. Thank you, Alex, for your wonderful translation, and I looking forward to see you all soon. All the participants see you all soon in the webinar on Thatu.